They said in part in a statement that, quote, they have continuously evaluated the science and continue to believe that there is no causal link between acetaminophen use during pregnancy and autism. Now, in response to an NBC News inquiry, an HHS spokesperson also responded to us saying, quote, until we release the final report, any claims about its contents are nothing more than speculation, but they insist and claim that they will use, quote, gold standard science, Kate and Zinkley. Now, as for that report that the Wall Street Journal is saying will come out, they say that that should be at some point at the end of this month. Of course, that will tell us all the further details and what's going to be in this, but we're all waiting for that.
Yeah, Marissa, thank you. Dr. Lucky, let's bring you in here because there is just so much conflicting information regarding pregnant women who are taking Tylenol and autism. What exactly does the science say? Home need to know.
And OBGYNs like myself are still telling patients if you have fever or pain in pregnancy, it is safe to take Tylenol. And when it comes to studying outcomes from exposures in pregnancy, it can be really challenging because you can't really enroll pregnant women in trials the same way you can other people. So we're relying on observational studies, meaning women are filling out questionnaires, looking back in time at when they were pregnant, what did they put in and on their bodies, what were their behaviors, but there is no new link or no new information. This is all based on those observational studies that show associations, but associating two different things doesn't necessarily mean one caused the other, and that is the important distinction. Actually, the biggest study we have last year came out in 2024, looking at over 2 million children, and what they did was initially they saw an association, just like some of the other studies, but at two different siblings at least, where one was exposed in utero and one wasn't, and that difference that they saw, that association disappeared. So they said, based on this, our conclusion is this is likely genetic or related to the familial environment. And nothing has changed with, the FDA guidance or American College of OBGYNs, and people should be reassured about that.
So that said, your patients, when you're seeing people, are you still saying if you have pain, if you have a headache, 'cause it's not just headaches, right?
Yes.
It's a lot of things, you're still saying go ahead and take acetaminophen?
Fever is an independent risk factor for some of these adverse neurodevelopmental outcomes, so it's actually dangerous to not treat fevers. So yes, we tell patients treat your fevers, treat your pain, because that can lead to better outcomes in pregnancy.
Really important information, Dr. Lucky C. Khan, Marissa Parra. Thank you both.